Hi, I'd like to talk to you about a condition called fourth cranial nerve palsy. And this is a condition that causes double vision and actually slanted double vision. This is often due to a traumatic sports injury. And what I'd like to do in this video is go over some of the situations that occurred to me in a bicycle accident so that you will have more information to deal with this very problematic disease that causes a lot of anxiety. So anyway, let's get right down to it. This past June, I was involved in a bicycle accident while racing in a criterium and ended up crashing over another cyclist and hitting the back of my head and actually breaking 6 ribs. I was knocked out and transported to a trauma center. And I didn't find out until many days later that I was seeing double. For the first 2 or 3 days, I was heavily medicated for the rib pain. But I noticed after getting up and walking in the hallway at the hospital that as I looked downward, everything was double and slightly slanted to one side, and it was very troubling. I reported it to the doctors, and they said that it could be a side effect of the narcotic that I was taking, and that they would take me off of that and see if the condition improved. Well, it didn't improve. And they did MRIs, CAT scan, and it turned out that the diagnosis was called fourth cranial nerve palsy. And there's a nerve behind your head that is peripheral to the brain that when you hit the back of your head hard enough, it can bruise or damage that nerve that innervates the muscles of the eye on that particular side. So if you hit the right side of the posterior section of your head and bruise that fourth cranial nerve, then the muscle that controls the upper movement of your eye is paralyzed so that you can't converge with the left eye. So when you're looking, things are off. And it's a condition that lasts quite a long time. For me, it lasted over 5 months. And if you could imagine the anxiety and depression, along with that, I had severe vertigo. So as I went through YouTube and on the internet, I could not find a whole lot of serious scientific articles on this disease. I found a few that were a little bit helpful. But I wanted to explain certain things to you in this video that will help you get through this disease with a lot of hope. So anyway, I did get hooked up to an eye specialist at the hospital, and they made baseline measurements of my double vision. And I was able to come back once a month to check for improvement. So for the first couple of visits, there was no improvement whatsoever. And just getting along with daily activities of living was pretty torturous, especially things that you do normally with ease, such as eating, watching TV, reading books. Things like that are very compromised when you have double vision. Looking straight upward, I could see clear, but anything from midline below was double. So I found myself having to tuck my chin and tilt my head in order to see clearly. And if you could imagine maintaining this position 20, all your waking hours, of course your neck is going to start to spasm. And my neck was hurting really, really bad. And of course they said, well, you could patch one eye, patch the bad eye, and just use the left eye and you get the single vision. But I found that made me more off balance and more dizzy. So I wasn't able to get much relief with that. They also tried prism in my glass, and that didn't work at all. That just, to me, made it even worse. So basically, I was stuck with a bruised, paralyzed eye nerve that would just take time to, go back to normal. And in some cases, they said that it may not improve on its own, and I might require surgery. So then my anxiety level went up even higher. When you have a lot of anxiety and you become depressed, then you don't relax, you don't sleep well, and if you don't sleep well, then your brain will not heal. So that was one of the main problems. The thing that got me closer to recovery was getting rid of my vertigo. So when you hit your head, there are beads in the middle ear that are situated in an area that help you maintain your balance. And in traumatic head injuries, sometimes those beads will get thrown out of that pocket into other parts of the ear, and you can't maintain your balance and you become very dizzy. So I was able to go through a referral from my private doctor to a special physical therapist who lay you flat. They drop your head below your shoulders off the end of a table. They turn your head to one side and down, and what it does is it shakes those beads, those balance beads in your ear, back into the proper position. And when that happened, I felt extremely dizzy all of a sudden. But the therapist knew that that was a good sign that they were relocated in the proper position. And then she straightened my head, lifted me up, and before I left that office, I was not dizzy anymore. So I had basically 3.5 months of profound vertigo, and in one hour session, it was completely cured. And I noticed that when the dizziness was gone, I was able to sleep very deep and peacefully. And that's when all of a sudden I started to see improvement in my vision. A little bit by little over basically a 2-week period. And all of a sudden, boom, I'm back to normal. I could see clear. And it was a tremendous, tremendous relief to have my vision back without having to have surgery. So, if you can take anything away from this video, it is that if you do suffer a traumatic injury that leaves you with double vision and you have an MRI that's negative, they don't see any damage to the nerve, then it's bruised, and basically it takes a minimum of 3 to 6 months to clear up. It's an agonizing time to wait, but you can be hopeful and be assured in 90% of the cases, or even higher percentage of that your vision is going to come back. And the best thing to do is just go about your day and try not to think about it. And don't constantly test your vision, like looking down, oh God, it's still there. I can't deal with this anymore. Just, tuck your chin, turn your head, and just adapt the best that you can. Sit, read books, do things that you enjoy, stay calm. and it will most likely get better. And I really hope that this video will help you, give you a little bit of insight and information on the progress to recovery of fourth cranial nerve palsy.